What is medical anosognosia with regards to testosterone treatment? I asked expert Dr. Jeffrey Ruterbusch.
Please like and subscribe. Thank you.
And hit that notification bell so you won't miss anything. What is medical anosognosia with regards to anabolic steroids and the TOT?
Okay, now this is a big one. So there's a psychiatrist friend of mine, I know him very well, Dr. Peter Bregan. Brain disabling treatments in psychiatry. Okay, so it's important. It's actually called intoxication anosognosia. It's called, I call it medication because he calls it intoxication anosognosia or medication spellbinding. So how does this relate to TOT? And this is an area I'm glad to talk about, and it's going to increase. It's going to resonate with a lot of guys. All right. Just like psychiatric medications actually will have an effect on brain neurotransmitters. That's how they work, right? He mentions that there's a thing called anosognosia, where your personality changes so gradually, you're unaware of it. Okay, so think about this. Yeah, it's more prevalent in psychotropic drugs, obviously, but think about this. We know testosterone has psychogenic effects, physical effects, emotional effects. So how does this relate to TOT? Let me tell you my experience with this. Every guy out there is either, maybe I'm presumptive here, but every guy's got a wife or girlfriend, right?
Mm-hmm.
And you better be careful when it comes to you doing TOT or stacking. In other words, because guess what? If your wife or girlfriend finds out you're doing testosterone, anything that goes south in your relationship, any argument, any fight you get in, any minimal situation, depression you may have, she's going to blame that on your testosterone. And I had it happen to me. I had an ex-wife that, we were going through a divorce, and things were not good. You're going through divorce. So she thought my unhappiness was due to the fact that I was on anabolic. And she took all my gear and smashed it with a hammer. So my point is, yes, you better be careful, because even though you may not notice any significant changes in your personality, and be honest, between you and I, when I was on testosterone, both TOT and big doses, I felt better. I was more confident. I had more initiative, more drive. I was not aggressive. So guys who are aggressive, period, if they're on testosterone, they may become more aggressive. Guys who are laid back, good personalities, they don't become aggressive, in my opinion. But this whole thing about intoxication in the anosognosia is, be aware that any slight difference in your personality is going to be attributed to you doing testosterone by your wife or girlfriend. So you better watch out for that, because she will blame that medication, even just physiological dosing. You'll get blamed for anything, any argument, any fight you get in, anytime you get depressed about anything, she's going to blame that. So you really have to be careful with this stuff, because it will be the fall. She'll find some reason to blame your unhappiness, the marital discord, anything on the fact that you're doing TOT. She will use that against you. See my point? So even though I don't think it changes personalities much like does, psychotropics, but it may be such a gradual change in your personality that you're not aware of it. And she's aware of it. And she will hone in on that and make your life miserable. You'll have to justify why you're doing TOT, and she will try to have you stop it. if she thinks it's changing your personality, and she will hone in on your personality changes and blame anything she can on testosterone. So be careful. If there's any change in your personality, your girlfriend or wife will attribute that to testosterone.
So
Serious. I've experienced it, and guys put me all the gym.
I understand and I can concur, but what do you propose then? To do that all a bit secretly?
Well, here's what I propose. Here's what I propose. One, you better make sure that you treat your wife or girlfriend special. Meaning, don't take a bad day at work and come home and kick the dog. Make sure you think twice about getting in an argument with her, because you want to maintain a good relationship with your girlfriend and wife. And so she's not thinking that your Dr. Jekyll and Mr. Hyde thing is caused by this. I mean, again, we all have bad days. We have days where we're down. We have days where we're dejected. We have days where we might get in an argument. I mean, every marriage goes through that. But if you want to maintain testosterone optimization, you better work real hard on making sure that you don't bring any ill feelings, animosities, hate, discontent home to your marriage or girlfriend. She will blame that on the testosterone. I'm telling you right now, it happened to me. I've got all kinds of patients come to me and say, man, doc, I feel great, man. Well, my wife and I got in an argument that day, just a routine argument. She said she wanted me to come off that testosterone. Tell her. People, no matter if they're on testosterone or not, they're going to have some spats. It's just part of life. And I apologize, honey, for coming home, and bringing this home. I'm human. I apologize, but you're going to have to backstep a lot if you're going to come home with bad attitudes.
And do you think
pay the price? She may throw your gear away and break it, demolish it with a hammer. Happened to me.
And do you think that's more of a problem in the usage of anabolic steroids?
Be careful of subtle changes in your personality you might not be aware of. Pardon me?
Do you think that's more of a problem in anabolic? Do you think that's more of a problem in anabolic steroids than in TOT?
I don't think so. I mean, obviously, you see, the change in personality is not as well documented as changes in personalities when it comes to these, psychotropics, especially SSRIs, or the other ones like Abilify. I'm just saying, as it occurs in psychiatry, it can occur in this field. And if your girlfriend and wife knows, and I said, I'm a broken record here, but if she knows you're on this stuff, she's going to have your behaviors under a magnifying glass. Anything out of the norm, even though it just could be regular stresses of life, she's going to blame it on testosterone, and she will try to get you to come off it. I've seen it. Patients come to me all the time. Doc, I'm feeling great, man, but my wife's convinced that my personality is changing. I don't think it is. She thinks it is. They're just looking for it. My point?
That's a very good point.
It's an important one. You want me to test on the rest of your life and get the benefits? You better make sure you don't take any animosity or anger home routinely, because she will blame your personality changes on testosterone. And I'm just saying, you'll lose her. You'll lose it. I've seen divorces occur because guys want to remain on top. And she says, me or Todd? And he says, Todd. Or he says, okay, you, honey. But he goes outside the marriage and does it. He takes his Todd at work, or he takes it at workplace. He hides it. And she finds out. And all hell breaks loose.
Great advice.
This is an important topic.
Yeah, it is. That's a topic we have to share with our HOT group. Yes.
Oh, for sure. So I'm telling you right now, you got your other half is going to keep your behavior under a magnifying glass. She's going to dissect it. And everything that she does not like about you that day, that week, she's going to say, you've changed since you've been on that testosterone.
Yeah, I can.
Even though you haven't, you said, no, you just look for something to blame this spat on.
And don't you think some men, once they get on testosterone, they get better, they feel better, and the relationship improves? Isn't that another possibility?
Yes, it can. But like anything else, life is not euphoric all day. It's not a utopia. I mean, you're gonna, even if that's the case for a man and she's happy with it, what if they get in a fight or he steps out one time?
Mm-hmm.
She's gonna blame that on his greater sex drive and testosterone, and she will make him come off it. Don't be doing that, guys.
Okay.
Doing that.
Thank you so much for all the great advice.
You make sure you love your wife or girlfriend and stroke them extra special. If you have to, write a logbook so you can prove to her, listen, look it, I told you I love you every day here for 100 straight days. I come home, I had a bad day, didn't tell you I loved you. And now you tell me my personality's changed because of testosterone. No, honey, not at all. I had a bad day. Sorry. It's important.
It
Very
is.
important.
Okay, thank you, Jeffrey. We have been talking for 1 hour and 50 minutes, so a lot of knowledge, a lot of experience that you shared with us. Thank you so much. And
well, the most exciting thing I want to talk about, Steve, today, to be honest or not, was that intoxication and anosognosia, because it's a fancy term. It's big in psychiatry, but I'm relating it to top because I've seen it ruin relationships and marriages. Okay.
Okay, so let's end this interview. Thank you so much for the podcast, Jeffrey, for your knowledge, and talk to you next time. Bye-bye.
Looking forward to it, Stephen.
Bye.
Bye-bye.